Hello everyone, we are Group 2 and today we'll be presenting about Hashimoto's thyroiditis. Our team consists of Ramisha, Grace, Wingsin, Najut and myself, Yi Yang. First of all, what is Hashimoto's thyroiditis? Hashimoto's thyroiditis is an autoimmune thyroid disease in which the affected organ is the thyroid, which is the gland located in front of your neck that produces hormones that control metabolism, including your heart rate and how quickly your body uses calories from the food that you eat. Hashimoto's thyroiditis is characterized by the destruction of thyroid cells by cell and antibody-mediated immune processes. The pathology of the disease involves the formation of anti-thyroid antibodies that attack the thyroid tissue, causing progressive fibrosis. The diagnosis is often challenging and may take time until later in the disease process. Hashimoto is the most common cause of hypothyroidism in developed countries, especially in the United States in individuals of 6 years and over. In contrast, the most common cause of hypothyroidism worldwide is an inadequate dietary intake of iodine. Women are more affected by men, with a female-to-male ratio of 10 to 1 or above. Most women are diagnosed between the ages of 30 to 50 years.
Hi, I'm Wingsin and now I'm going to talk about the signs and symptoms and the consequences of Hashimoto's thyroiditis. The signs and symptoms for Hashimoto's thyroiditis includes fatigue, increased sensitivity to cold, dry skin, constipation, muscle weakness and pain in the joints, puffy face and eyes, irregular hair loss, enlargement of the tongue, irregular periods and difficulty in concentrating. Moving on to the consequences of Hashimoto's thyroiditis, goitre can be resulted as the production of thyroid hormone decreases in Hashimoto's thyroiditis. This causes the pituitary gland to signal the thyroid to increase the hormone production, causing the enlargement of thyroid. Second, heart problems may also occur as hypothyroidism causes poor functioning of heart and bradycardia, further leading to cardiovascular diseases. People with Hashimoto's thyroiditis may also have mental health problems because hypothyroidism can cause frequent mood swings and also depression due to the difficulty in concentrating and fatigue. Married couples may also face difficulty in getting pregnant as hypothyroidism can cause irregular periods, reduced libido and ovulation problems in women, while men may have reduced libido, problems in erecting and low sperm count. Pregnant women with Hashimoto's thyroiditis may also have a higher risk of miscarriage or giving birth to a baby with developmental problems. Finally, myxedema, which is a term for severe hypothyroidism, can be caused by long-term and untreated Hashimoto's thyroiditis. Although it is rare, but it can be fatal. This is all from me and now I'm going to pass it to Ramisha. Thank you.
Thank you, Wingsin. My name is Ramisha and now we'll be talking about the causes. So Hashimoto's disease, it is an autoimmune disorder. The immune system creates antibodies that attack the thyroid cells as if they were bacteria, virus or some other foreign body. The immune system wrongly enlists the disease-fighting agents that damage cells and lead to cell death. So what causes the immune system to attack thyroid cells? It is not clear. The onset of disease may be related to genetic factors, environmental triggers such as infection, stress or radiation exposure, interactions between environmental and genetic factors. However, the following factors are associated with an increased risk of Hashimoto's disease, like sex or gender. Women are much more likelier to get Hashimoto's disease. Secondly, age. Hashimoto's disease can occur at any age but more commonly occurs during the middle age. Other autoimmune diseases. Having other autoimmune diseases such as rheumatoid arthritis, type 1 diabetes or lupus increases the risk of developing Hashimoto's disease. Genetics and family history. People are at a higher risk for Hashimoto's disease if they have family that have thyroid disorders or other autoimmune diseases. Pregnancy. Typical changes in immune function during pregnancy may be a factor in Hashimoto's disease that begins right after pregnancy. Excessive iodine intake. Too much iodine in the diet may function as a trigger among people already at a risk for Hashimoto's disease. Radiation exposure. So people who are exposed to excessive levels of environmental radiations are more prone to Hashimoto's disease. That will be all for the causes. Now I'll be passing it on to Grace.
Thank you, Ramisha. Greetings to all, I'm Grace. Let me continue with the pathophysiology and mechanism of Hashimoto thyroiditis. There are 3 possible reasons that lead to Hashimoto thyroiditis, such as molecular mimicry, genetic susceptibility, and concurrent autoimmune disease. T lymphocytes and B lymphocytes react to self-thyroid antigens. Lymphocytes infiltrate the thyroid glands. There is progressive depletion of thyroid epithelial cells, which are gradually replaced by mononuclear cell infiltration and fibrosis. T cells and B cells are activated. Sensitization of autoreactive CD4 T cells to thyroid antigen appears to be the initiating agent. CD8 cytotoxic T cells may cause thyroid cell destruction by one of 2 pathways, which are exocytosis of Granzyme granules or engagement of their receptors, specifically CD95 on the target cell. CD4 T cells produce inflammatory cytokines in the immediate thyroid milieu with resultant recruitment and activation of macrophages as well as damage of follicles. The production of anti-thyroid antibodies increases due to the activation of B cells, whereas T cell-mediated destruction of the thyroid gland due to the activation of T cells. This may result in inflammation and loss of normal thyroid gland architecture. Therefore, the production and secretion of T3 and T4 from the thyroid gland decreases. This may also lead to hypothyroidism. That's all from me. I will now pass on to Najut to continue with diagnosis and treatment. Thank you.
Hi, I'm Najut and I'll be looking into the diagnosis of the disease. During physical examination, if a person has Hashimoto thyroiditis, they are likely to have a puffy face with periorbital edema typical of hypothyroidism. Cold, dry and rough skin may also be observed with thick and brittle nails. During the enlargement of the tongue, it is likely that they will have a slow speech. They are likely to have peripheral edema of the hands and feet as well. Other observations include elevated blood pressure, bradycardia, and diminished tender reflexes with prolonged relaxation phase. To diagnose the disease, thyroid function tests can also be performed. It is likely that there will be an increase in TSH level with a decrease in T4 level if the person has the disease. Furthermore, antibody testing can also be done. It is likely that the person will have TPO antibodies in their blood if they have the disease. Presence of anti-TPO antibodies describe the cause of hypothyroidism as Hashimoto thyroiditis or its variant. For both of these tests, blood collection is required. However, no special preparation is needed before the collection of the blood. In differential diagnosis of thyroid nodules, ultrasound-guided fine needle biopsy is an effective method to distinguish Hashimoto thyroiditis from other thyroid disorders. This method uses sound wave to locate nodule or abnormality within the thyroid and remove a tissue sample for examination under microscope. This procedure is less invasive than surgical biopsy, leading to little to no scarring. Next, I'll be looking into the treatments. The main treatment available for Hashimoto thyroiditis is thyroid hormone replacement. The drug of choice is titrated levothyroxine sodium, which has a half-life of 7 days and can be administered orally. The standard dosage is 1.6 to 1.8 mcg/kg per day, but it can vary from patient to patient. It should not be given with iron or calcium supplements, aluminium hydroxide, and proton pump inhibitors to avoid suboptimal absorption. It is best to be taken early in the morning on an empty stomach for optimum absorption. That's all for me. I'll be passing on to Yi Yang. Thank you.
Moving on to the conclusion. Hashimoto's thyroiditis is an autoimmune thyroid disease that is characterized by the destruction of thyroid cells by cell and antibody-mediated immune processes. Common symptoms of Hashimoto's thyroiditis include fatigue, muscle weakness, and drowsiness. Hashimoto often leads to a formation of goiter, heart problems, and mental health problems. Pathophysiology of Hashimoto includes molecular mimicry, genetic susceptibility, and concurrent autoimmune disease. The causes for the immune system to attack thyroid cells remain unclear. However, the onset of the disease may be related to genetic factors, environmental triggers, and interactions between environmental and genetic factors. Hashimoto's disease risk factors include gender, age, concurrent autoimmune disease, and genetics and family history. Moving on to the diagnosis of Hashimoto, some physical findings include puffy face, cold and dry skin, and bradycardia. For the clinical diagnosis, a combination of TSH test and T4 test can be conducted to test for hypothyroidism. When there is an increased TSH level and a low total T4 or free T4 level, it supports the diagnosis of hypothyroidism. Other tests for Hashimoto's thyroiditis include antibody testing, ultrasonography, and fine needle aspiration cytology. Lastly, the main treatment for Hashimoto's thyroiditis would be thyroid hormone replacement. The drug of choice for this treatment is titrated levothyroxine sodium. That is all from us. Thank you.